Hello and good evening. Okay, so we are live on One once again. My name is Titi. Thank you so much for being a part of our live stream. Now we are live on quite a few platforms. And yeah, whichever platform you're listening or viewing us from, we appreciate you. Please try subscribe, hit the notification bell, and do what you can to be part of the conversation. You can, of course, use the comment section of whatever platform you are listening or viewing us from with your questions, contributions to today's topic, which is this: the future of personalized healthcare. We have the team from Ajuda talking to us today, and it's going to be a really interesting conversation. I have to tell you. Now, healthcare has become one of those things that, well, it's always been an essential service. However, with the advent of all sorts of different technological options, we have the opportunity to improve on the type of healthcare we are exposed to, or we involve our families in. And it's just become so interesting over the years what we've been able to achieve. I'm going to bring in the team from Ajuda in just a second, but I would like you to ask yourselves a simple question. What are you doing to improve on your family's opportunities to have better healthcare? What are you doing to make sure that you do not run the risk of not having the right kind of cover for your family? Um, what steps are you taking to make sure your family is protected? Those are questions that we need to ask ourselves once in a while. And yeah, we will be doing that today. We will be. I would love to give you the opportunity to reach out to us. You can always send us an email if you'd like to be a part of the program at any point, and we will be getting back to you. If you'd like to be interviewed on the show, you can also send us an email. Just make sure you put in the hashtag there, one with Titi Onyiso, before you do. All right, then. I'm going to show you a very, very important logo in just a bit. And I would like you to go online and check out what this company is all about. Okay, then. Thanks for staying with us. And now, Ajuda is a platform that is really interesting one. Let's talk to you about what they're all about. We're going to dive into the innovative world of digital health records. Dr. Liza Street and Taryn Uhlmann are co-founders of Ajuda, and it's a secure digital health vault designed to empower individuals with easy access to their personal and family health information. Now, Dr. Liza Street is a pediatrician, and Taryn is a seasoned business executive. And today they're going to be sharing their journey in creating Ajuda. I'm so pleased to have them join us today. Hello, Taryn. Hello.
Titi.
Hello, Lisa. Good
Hello.
evening.
Good evening. Thank you for having us on your show this evening.
Thank you so much for joining me. And yeah, we are a little bit tardy on starting today, but not to worry. It's going to be worth it. It's going to be worth the wait. But please talk to us about your relationship, who you are, what you stand for together, and how Ajuda came to be.
Sure. So We met 10 years ago, actually, when Liza, as a pediatrician, was looking after my children. And really, over the years, had stayed in touch. But what was crucial in the beginning of this was a discussion where, I've been working for a very long time as a busy corporate executive in the technology and marketing space. Liza, as a pediatrician, was working in a very busy practice. And we realized that we actually had some very common problems as patient and as doctor. From my perspective, as a patient, or as a person on the ground, as not a non-medical person, we were very much, it was enormously frustrating as a parent with 3 children, all at different ages, at a point, all at different schools, and trying to actually keep track of their health, trying to keep track of all of their records, their vaccination records, their milestones. And you forget as a parent how often that information is needed. And so if I would go and see a doctor like Liza, and she needed information from me, I never had it on hand. It was either in a cupboard, in a file, or it was on another app, or it was somewhere, but not with me. And that was really the purpose of Ajuda, is to make sure that I, or you as an individual, have all of your health data with you wherever you go.
And to add to what Taryn was saying, really the idea was born at a doctor-patient consultation, where it was just after COVID, and we met at a home visit. And when she was looking for all the information to help me with getting an accurate diagnosis with her child, we got chatting at that consultation, saying the same frustrations you're feeling as a patient, I'm feeling as a doctor, because we don't have access to our records on hand so easily. So that little conversation was the seed of what grew into Ajuda. We started having more frequent conversations in the morning and before we went to work. And over time, we realized we really had something special, because we started doing a lot of research, and this just didn't seem to, there was a gap that we needed to solve this problem.
I actually felt that gap myself. So just a little backstory. I have twin girls. They're 11 years old now. And I can remember storing all their receipts and records, all those little bits of paper, test results, etc., in a Ziploc bag. I had them in a zippy bag. I divided them into 2 Ziploc bags and then put them in one bag, because I had to separate each twin's information. And I had it in their underwear drawer, of all places, because I just didn't want it to get mixed up with all the other documents on my desk. And I just knew that there were going to be days they needed a vaccination or something, and I needed that information. I just wanted to go somewhere immediately and get it. So I understand that gap. I really connect with what you're trying to achieve. But it is one thing to have an idea, and then it's another thing to hop, skip, and jump to creating a company as elaborate as this. I'm not going to call it big yet, because you haven't really told us how large your project is, but I know you're going to get there. So Ajuda started off as a really interesting, great idea. You're trying to fill in a particular gap. What were the first steps you took from there?
Well, when we started, it's evolved a lot over the 2 to 3 years that we've been working together. In the beginning, Liza obviously was a pediatrician. She had a busy practice. I was working full time in a corporate role. I'm sorry, those are the lights that have gone off, because we'll just sit like that.
We are very familiar with this. We are extremely familiar with this.
Got to keep it natural here on this podcast. So we just want to work with what. But we actually started to meet. Our boys, in fact, both our boys are 11 years old as well. We have other ages, but we know where you are. And we would drop them at school, and there was a little coffee shop that was at the school. So we would actually meet there for an hour, from about 7:30 to about 8:30, before Liza went to her practice and before I went to my job for the rest. And we sort of coined a term along the way, and we said there's the power of the hour, because we did so much in that 1 hour every single day, and incrementally those hours added up. And we actually did so much. We built a very brought out a prototype, and we designed the thoughts and where we were going. And fast forward to the 2 years where we are now working full time on this. We've just added more time and more expertise as we've gone. And after also a huge amount of research and meeting lots of people in the industry, it's guided us from one person to the next. And it's been a hugely rewarding process.
And, it's quite tricky because you, as you were saying, you don't want to just go from an idea. What gets you from the idea to the next step? And I think it was realizing we really did want to solve this problem, but we wanted to make an educated decision here. If you look online, there are hundreds of thousands of medical apps available, of which most of them don't have more than 10,000 users that have signed up. So that's very little. There wasn't much traction on a lot of medical apps. So we felt like we didn't want to be those two people that were just trying to build another health tech app and just was trying to do something different. But actually, we wanted to make sure we weren't making any wrong decisions or going the wrong direction. So we did a lot of research. We knew every player that was available on the continent, and then we looked abroad and we made sure that we could say, what are they doing wrong? And what can we do better? And how can we be better at what's available for the consumer? So I think the research took a long time, and that's why a lot of people say startups are quick. You just kind of come up with an idea and off you go and you fly within. That didn't happen with us because it is health tech, and health is such a special place to work. As a pediatrician, your health is precious. It needs to be secure. Your data and information is very important of who has prying eyes to see what your data is showing. And so it was through that research that we realized, by looking at everyone else's mistakes, what can we create that is different, that is for the consumer and really can help us? And I think we just loved working together.
Yeah.
So in the beginning, we didn't really know each other. Those early coffees were awkward. Doctor patient, like going out for a coffee. And as we started working, getting to know each other, now we actually complete each other's sentences. It's been fabulous. So, and I think it was after 1 year of working together, you think, well, we've done so much, we can't stop now.
Yeah.
And after 2 years, you're like, well, really
can't
stop now.
I can't stop. So
So that's how we got to this point.
I'm really pleased to hear that this was something that built from literally from scratch. There was a seed that was planted and it's growing, it's blossoming, and you've gotten to a stage where there's no turning back now. I would like to give a little background into both of the people I'm speaking with so that the viewers have a bit more information. Now, inspired by compassionate care that she received during her childhood, Dr. Liza Street dedicated her career to healthcare. Now, she's a qualified pediatrician with over 10 years of experience in public and private clinical patient management and end-to-end practice administration. Her passion for clinical excellence, improving outcomes, and holistic patient care apparently was one of the reasons why she decided to co-found Ajuda. Now, let me talk a bit about the platform here. It's outcomes based. I love the fact that you added that to the profile. It's about outcomes. Now, you're focused on tracking health improvements in patients and clients, and the emphasis is preventative healthcare. Okay, so that's a very interesting focus. A lot of other health practitioners and other companies are on focusing on people who already live with certain conditions. But this is preventative care. Why did you decide to go down that particular route? Sorry, I was going to say that particular street with a pun there somewhere.
I like it.
But then again, if it is outcomes based and not profit based, as of right now, right? How sustainable is this platform going to be? So you need to let us in on this. Who's going to take that? Taryn or Dr. Liza?
Let me answer half of a question.
Do the first bit, I'll do the second bit. There we go.
So really, in healthcare, people are more reactive than proactive. And that's why preventative healthcare is really overlooked. And a lot of the time, patients and everyone, all of us, we need to be incentivized to do something a lot of, proactively and going to get screenings, etc. particularly in the pediatric population, a lot of what we do in pediatrics is to prevent you from getting sick. So your children get vaccinated so you don't get those horrible illnesses that actually kill your child. People are not scared of a lot of vaccine preventable conditions purely because they don't see children dying from those things anymore, because the vaccine over the years has been so effective. So preventative healthcare is huge, and in pediatrics, we do hearing tests when a newborn baby is born to check if there is a problem. We need to sort it out within the first 3 months because it affects their trajectory in life. So early diagnosis in pediatrics can ultimately affect children. And the same thing, we always say healthy children equals healthy adults. So when the whole pediatric our philosophy is to make sure that we screen and we prevent and we catch conditions early in a child that's basically, it's an empty palate. You don't have anything wrong with them. So if we can teach them to look after themselves, and we can educate them and we vaccinate and we do all those preventative things as part of routine and proactively, that becomes second nature to these children. And as they grow, they will continue to be healthy adults. So that just answers why preventative was so important, and the outcomes then will follow. From a sustainability, I'll let Taryn take that one over.
Yeah, I mean, I think also just as a segue in the conversation, when you look at healthcare apps generally speaking, and we're very appreciative of the fact that you are showing everything so beautifully. But when you look at healthcare apps generally, they're very medical, they're very clinical, they are sometimes scary, and sometimes they're functional. We didn't want to do that. We see that a lot of the tech solutions and any solution that exists currently tend to be corporate driven as opposed to, or corporate focused as opposed to being consumer focused. So one of the things that we feel is quite unique with what we are doing is that we're really focusing on the end user, which we don't want to call a patient, because we don't believe that the patient is always sick. You can be well and you can be sick. You're a person with children, with parents and family that you care for, and we need to be there for you the whole way. And so in that process, we concurrently also believe that it is your right to access your health information and to access that for free. And so the base platform that you are seeing here is entirely for free. If you go to www.ajuda.co.za as you are on now, and you can actually go through the process, you can upload the records that you may have sitting in your Ziploc bag in your child's drawer. All of that is available for you to use currently at no cost. That is outcomes based, and we want to get as many people using it and feeling secure. In the process, however, we have got a lot of other added values that we are bringing in, some very exciting new features and products. And one of the things that we did in our extensive research was really try to understand at a consumer level, what did people want? And there's certain things that they want. They want to have their records on hand. They want to be able to book instantly online. They want to be able to send and redeem scripts. There's a few other things, and all of those things we are in the process of doing, where we can actually make your life better and easier. And by bringing in those value-added services, there will be opportunities for us as a business to earn a revenue and to be sustainable. One of the things we've learned very much is that when outcome-based and in the healthcare space, if you are not sustainable and if you are purely donor-funded and purely reliant, often those are the businesses that just can't sustain their good work that they're doing. So we are really having two components to our business. We've got a very strong public health component that is going to be very much working with various stakeholders. But on the other hand, we've also got a sustainable business model to support us.
Okay, so let me give a little background on Taryn now. Of course, she's already blown our mind with the information she just gave us now. I need to tell people who you are right now. Now, Taryn Uhlmann, I got that right, I hope? Uhlmann?
Perfect.
Fantastic. A seasoned business executive with over 20 years experience driving growth and innovation in the media and recording, or rather video streaming industries. Now, she has a proven track record in content licensing, marketing, operations, team management, and apparently in 2023, she founded Bloomburst, a specialist consulting firm that empowers businesses to navigate and thrive in the media space. I think we should have a conversation maybe later on. I need some help. Her current focus is, of course, on developing health tech solutions such as Ajuda that enable individuals manage their health and their families' health effortlessly and optimally. So yes, optimally is where I was going with this. we have become, of course, come into a tech age. Children being born now don't know of a time when there wasn't a cell phone without buttons. Um, we have come to a place where literally everything you need has been put into a device, and consumer driven tech has become, the order of the day. However, not everyone is as techie as we would like them to be. There were a lot of projections earlier in the 2000s saying, oh, everyone's going to be on board by 2022, 2023, 2024. But the statistics aren't growing as fast as we would like them to be. So this business is completely tech driven. Do you have any plans of bringing this into a more tangible or fungible terms? Are you taking this into healthcare facilities, into care homes? Are you taking this into the pediatrician's office? Are you doing the one-on-ones, or are you going to stay online?
Carry on.
I was going to say, have you been listening in on our conversations?
Yeah.
Because exactly that. We can't. You have to. It goes hand in hand. One of the hardest things we found, in our biggest challenge, I should say, in the doctor medical space is change management. So we're well aware that the doctors are going to take very long to adopt. The doctors who do use tech currently are those that have a passion for it and they enjoy it, and they'll use a couple of apps. But mostly the health tech that has caused most what's the word I'm looking for? Change within the doctor spaces in the private sector, when it's facilitated their practice management and their billing and that, because it's streamlined their businesses. So from a business perspective, they've been able to transform. However, from a patient interaction, that hasn't really happened. So you're quite right. What we've done when we've designed Ajuda, at this point, once you've gone on and you complete the questions, on the onboarding, basically, it creates what we call a one-time form. And that one-time form is something that the patient is empowered with all their information to take to the doctor, paper-based, so that the doctor who's not digitally transformed yet has all your health information on a piece of paper that they need to know from basically what your allergies are, what your past medical history is, your surgeries, all that important information that when you're across the consultation room, you may forget. In the consultation room, you'll forget to tell them. So because your child is screaming and you haven't slept all night, or for whatever reason you stress, it's a very stressful time when you visit the doctor. So our one-time form is paper-based and it's digital. It's not just one or the other, to help with that change management of the doctors. So everything we've done. The other thing we've done is, yes, we're going out into certain environments where we can reach most of our target population, because not everyone is technically driven, like you say. We're not targeting the very elderly population, because they're not going to want to go onto an app and do this. Retrospective records for them will take a lot longer than a mom who's in her 20s to 40s, and she can start from when the baby's born to just upload records as every time she consults with a different provider. So,
and just to add on to that, one of the things that we really are we often say that our children are going to look at us in 15, 20 years or even sooner time and say, how on earth is it that you didn't have all of your medical records? How on earth do you not know or have a list or easy access to all the medications you've been prescribed? How is it that you went on holiday and got an ear infection and were given an antibiotic, and a month later you were back home and you've got something else and you were given the same antibiotic? And who's managing and watching over that holistic care? And so I think a big part of this is about starting now and building those records wherever you are in your life at your point. Somebody said to us earlier today that they're caring for their child and they feel I think it's her son is a special needs son, and he is somebody who is very he's had like 34 appointments in this year already. And she says, I've got all of that information, but it's not uploaded and I'm not on top of it. And I feel like a bad mom. And so that mom guilt around parenting is with all of us. No matter how good you are as a mom, the mom guilt is there. And, we've picked that up. And so I think on the other side of tech savviness, when it comes to consumers are also not all entirely tech savvy. We social media savvy, certainly in a certain age group. But this sort of generation of having your children, looking after your parents potentially as well, you've got a lot to manage. You're busy. More often than not, both members of the family, both parents are working. You're juggling 20 balls. We are saying this is the one ball you don't need to juggle anymore because we've got you and we've created something easy to use.
Fantastic. Amazing. Now, some people have already started putting some comments in the comment section. We have a comment here from Leslie Dakana, who says, wonderful initiative. I wish you all the best. And that is exactly how I feel as well. As a mom who had to juggle quite a few things, being in the media is one of them, having to make sure I don't lose touch too much. Thankfully, I had my mom with me. I have her, and she was always the one reminding me, oh, they need to go for a dental check. They need to do this. They need to do that. But not everyone has that. So you've definitely helped to plug a particular hole here. But I want to talk a little bit about the fact that you call it a vault. Now, a lot of people are interested in security of their information. People really want privacy. Now, we have heard of the emergence of so many types of, let's say, Web3 blockchain-based applications, for instance, that sort of promise a sort of added security. What have Ajuda put in place to make sure that all this information is secure and invulnerable to people we don't want having access to them?
So security for us has been paramount from the beginning. And that's not necessarily only technical security, but, at the end of the day, this is your health records, your health information. The tech company we've worked with, we've been very clear that this is paramount. In the same way that we or the certain industries approach banking, we want that same level of protection. So we are compliant with all the various different regulatory components that ensure that we are, for example, POPIA compliant. That's the privacy protection, that we are GDPR compliant, so technically you're compliant. We actually had a question the other day around cyberbullying and how do we use that. Everything that we have built has made sure that not only the records are entirely safe and secure, but the communication mediums between doctors as we evolve is going to be, and patients is going to be enormously very secure. So we almost describe it as we go, we've got three steps to our growth. The first one is what you see today, which allows any person to be able to upload information. And we called it a vault very intentionally because of the security that we wanted to get across. And if you go into all of our documentation, you will see it is very clearly written, it's comfortably understood, it's transparent. We want people to feel comfortable. The second component that we are busy with now is what we call integrations with multiple players in the ecosystem. So whether that's the insurers or whether that is the hospitals or the clinics or the labs, etc., all of those are under stringent security themselves, and we have to comply with that. So any integration where that data flows through, we always call it a tunnel where it flows from one side to the other. It's flowing from one secure space into another secure space and entirely encrypted. And then the last bit that we are looking to do is really where the collaboration happens between doctor and patient in the app. And again, that tunnel of communication is entirely secure. So from a security point of view, it is constantly. Just today, we were meeting with our tech team and a whole lot of questions about where we are with this and where we are with that, and we've made it a priority.
At a point, priority.
Maybe if I could just jump in, and it's actually
okay. Go ahead, please. Go ahead.
I was just going to fill the silence. It was just to say a little bit earlier that in terms of just going back to being tech savvy, tech savvy comes with being security savvy too, and cyber savvy. And I think that we are so sometimes scared of tech and so nervous of going down that road. And I mean, little things like e-commerce and it took so long for people to really get comfortable. So we are not, we're not naive to the fact that, that there will be, as we said, change that comes with it and time that comes with it. But one of the key things we've done, even in the design of our site, is we've kept the copy and the words to a minimum as far as possible. It's very colloquial and very chatty, and it's very visual. And we did that very intentionally to help people to feel comfortable and to be guided along the way in such a way that they also felt secure and they understood what they were doing. It wasn't just a sort of figure your way around and do it. So outside of the actual stringent security that is in place, I think the way our actual user experience presents a secure engagement.
So security has always been a priority for most people. But I don't even know if the term is security. I think the term could be trust, creating some kind of trust. And people have found a way to trust their pediatrician. They've found a way to trust their doctor, that their doctor knows exactly what to do. But once there is that technological barrier, that interaction seems to be lost in some cases. But I do know that you are leveraging on AI, machine learning, providing personalized recommendations for people. Where do we draw the line or compare and contrast how familiar Dr. Liza could be with her patient and how AI would respond to my patient's needs? I'm just trying to sort of figure out if there is that, I don't want to use the term cold approach to things once you take things online, once you take things into tech. Have you considered this?
So just to add to the security, and as you were speaking, exactly that, a lot of what we do now is we realize that a lot of our health records are already being transferred on emails and on WhatsApp and technically. So when we talk about the transfer of information via Ajuda, it's more secure than what's currently being in play in the digital world. So we are sending emails and we're sending all our personal information via emails all the time and prescriptions via WhatsApp. It's happening more and more in my practice. I'm finding that more and more moms are engaging me on these chats. And yes, there are secure chats. I'm not worried about that. But they are becoming something people are more comfortable with. To ask questions, and you can give advice, etc. on a WhatsApp. I'm frequently on WhatsApp with my patients. So, less so now as I'm leaving the practice, but just what you're saying about AI is going to get used. There is so many platforms available where people can go and ask a question. You can go into any open AI or anything at the moment and go and say, can I use this medication with this medication? And it's going to spit out an answer. So what we need to do from the health industry is to really make sure that we are giving people an opportunity to use AI responsibly. So we need to create those platforms because they're going to use it otherwise without us. So instead of allowing people to go in to use the AI that hasn't been experimental specifically in the healthcare industry, you're going to actually let them be exposed more in a dangerous environment than in a protected environment. So we'd rather you go into an environment where it's been tested and experimented and it's going to give you safe information than let you go and do it on your own and not have your hand been held. And so that's why it is our responsibility to make sure, number one, you're transferring information everywhere at the moment. Let's put it secure in one vault. You're looking for Dr. Google, I always say, on everyone goes on and they're looking for advice. Let's give you the correct advice from where the country that you're in, so that you are given we're holding your hand with AI because it's going to come. We're not going to be able to completely avoid it, but I think we need to do it responsibly.
Okay. And maybe to add also to your question about it being cold.
Oh, yes.
I think that, to the point is that it's already being used. Technology is being used. Google is being used. Those tools are there. So, and no one is really seeing it as cold in that initial interaction. And, obviously from an online perspective, this is not a diagnostic tool. However, it will have multiple tools that will guide you to have your best health in hand. One of the things we often say is that, we all used to trust our health, trust our ability to manage our health and to manage our children's health. Now, if we have a temperature, or our children have a temperature of 39 degrees, we rush them off to casualty because we're worried. We don't trust ourselves anymore. And so being able to provide through AI and through prompts and through information sharing, a lot of the basic primary healthcare components that did exist in a smaller environment and community, exactly as you were saying with your mom who she's what we are. We're your technical mom. We are the ones saying to you, don't forget to do this. And have you thought of this? And don't stress. I've got you here. This is what you need. And then when you move, and so it's a very warm engagement, actually, is what we're trying to create, even though it's online. And the next step is that then you don't need to go to 3 doctors before you see a specialist. Hopefully you've got it in hand to a degree. And when you really need to go, then you will have that face-to-face interaction. That is that warm bedside manner, and that can happen. So we're not replacing doctors. That's not the intent. We're trying to encourage and support people to be more empowered to manage their health.
Thank you so much. I couldn't have said it better myself, really, because I have developed a sort of confidence. Not comfort yet, confidence in tech. I'm getting to the comfort part, but I'm just really glad that it's being used for really great things. But I want to hear as quickly as possible. We have to wrap it up soon. As quickly as possible, what sort of feedback you've received from people that use your platform, and what are maybe the funniest things you've heard, or the most interesting things you've heard about people who've decided to work with you.
So I must say we've had quite a lot of feedback since we had an interview on one of the news channels here on the weekend, and there's been fabulous feedback that there a lot of women in particular. It's been more the women that have come back to us that have said, wow, I know, I'm feeling like, where should I put all this information? I was feeling so disorganized. Now I feel like I can catalog, it's color coded, it's organized, and it's just making them feel like they're more on top of their kids' health. So a lot of our feedback has been from females, which has been quite an interesting thing. Also, I've found that a lot more doctors are interested in being involved. They're finding that we need something, that there's not enough, there isn't tools available to them. You know, a lot of the tools don't solve the problems. And so because we have our full one-time form, which contains the health profile, that is very valuable for a doctor. And they love that they now don't have to ask the patients in the room all that information, that it comes to them. They can just go from there into the next question, and then they can move on and have a more convenient consultation. So that's been some feedback.
Yeah, I mean, exactly. It's been really, really wonderful, and we're very excited about the collaboration opportunities that are coming from this week, both within the industry and then, of course, from the people using it. It's been wonderful so far. It's a very exciting time that we're in.
And I think one question a lot is people asking, is it free? Yes, it is free at the moment. You know, everything, your health record should be free. You know, the add-on features are things you would be paying for anyway. When we bring those in, there are things that it's nothing different. It's just we're just adding it technically.
Okay.
And it's not
all right then. I have to say a big thank you to you, Taryn and Dr. Liza, for talking to us about Ajuda today. Well done with putting this together, and I really have a really great feeling about this. Any expansion outside SA coming up anytime soon?
Yes, definitely. I mean, we obviously starting in South Africa, but we've already got a sub-Saharan African view and vision, particularly with our work with children through schools. But at the end of the day, you know, this is something that, as technology is as it is, can be used anywhere in the world. So we hope that it will be broadly adopted wherever. But right now, focus is South Africa, and then moving up the continent. Fantastic. We'll meet you in person next time.
Yeah.
Thank you so much for joining us today on One-on-One. Now, if you're just tuning in, we've been talking about healthcare, and from a really interesting angle, from the future of personalized healthcare. And Ajuda is one of those platforms you need to look out for. Just visit them. That's ajuda.co.za to find out more about what they're up to. And as you can see, they're all hands-on, and they're ready to answer your questions as soon as you have them. You can always use our comment section, depending on what platform you're using. Make sure you subscribe to this YouTube channel, hit the notification bell so you don't miss a thing. Later on, we're going to be having loads of other great conversations come your way very soon. Let me let you guys go. I know you're very, very busy, but thank you once again.
Thank you so
very
much.
Bye.
All right, then. So you heard it here first. I'm going to say that officially. You heard it here first. There's so many different opportunities out there for people to leverage on AI, machine learning, to leverage on personalized health recommendations, preventative solutions. And people are working on different projects to make sure that they fill in certain gaps. We on One-on-One do what we can to make sure that we provide conversations with people that don't get that much airtime. Yeah, not many people are talking about these things, and we sort of make it a point of call to have these conversations for you. All right, then, if you would like to be a part of One-on-One anytime soon, it's very easy. If you'd like to be interviewed or you have a conversation you'd like to have with us, please send us an email. That's dynamitepodcastnetwork@gmail.com. That's dynamitepodcastnetwork@gmail.com.